Welcome back. Do you feel discomfort while walking, sitting, or even doing some daily routine, some activities that you used to love but now you can't? The problem could be your hips. And joining us now on the show is Dr. Carl Freeman. He is with Jacksonville Orthopedic Institute. Thank you so much, Dr. Freeman, for being here. And first, I got to say, sir, thank you for your service.
Oh, thank you.
I know you are a Navy veteran and served here at NAS. And so let's first talk a little bit about yourself and what brought you to Jacksonville.
Well, I grew up in Nashville, Tennessee, and I went to medical school at Georgetown in Washington, D.C. It was the Navy that sent me to Jacksonville. I served at NAS Jax at the Naval Hospital as an orthopedic surgeon for 4 years. During those 4 years, my wife and I had 2 children, and we decided at the end of our 4 years there that we loved this city so much that we wanted to stay and make it our home.
Well, and we just met your wife, too. She came on to the show. She's sitting right off in the wing, and well, we're happy to have you, and welcome to Jacksonville.
Thank you.
And let's talk a little bit about what you do as an orthopedic surgeon, because that's something that actually a family member of mine, they've gotten to know you guys very well as of recently. So what kind of injuries do you treat? What do you see most patients coming into your office complaining about?
Well, as an orthopedic surgeon, I treat patients of all ages. I'm an orthopedic surgeon trained in sports medicine and joint replacement. I treat anyone from teenagers with sports injuries to older patients with debilitating arthritis. Most patients can be treated without surgery, but the ones who have injuries so severe that they do need surgery, I perform those surgeries. I also do joint replacement of the knees, hips, and shoulders.
Well, let's talk about hip preservation surgeries, and I understand that you are one of the few who are specifically trained in this area to do this, but I don't think a lot of people are familiar with about what this preservation surgery is all about. You think hip replacement, but not preservation.
This is something I'm very passionate about. Hip preservation surgery is surgery to address hip pain with the goal of delaying or preventing the kind of joint damage and debilitating arthritis that goes on to require hip replacement. Many people have hip pain and groin pain, but most people don't need a hip replacement. Patients who benefit from hip preservation surgery are people of all ages, from teenagers to active adults who have significant hip and groin pain. It turns out that many of these people have a hip condition that's causing the pain that leads to irreparable joint damage and eventually arthritis. So it's hip preserving. It's a hip preservation procedure. An example would be femoral acetabular impingement or hip impingement. This is a painful mechanical disorder that causes significant hip and groin pain, and it's caused by an abnormal shape of the hip joint. If it's severe enough, it can be treated with a surgery that stops the cycle of damage and therefore preserves the hip joint. Essentially, the surgery consists of reshaping the hip joint and repairing the labrum to stop this cycle of damage.
And it sounds so important to get in then before the damage can be done, so then you don't have to go in and do the replacement. How does one get specialized training for this? How did this even come about? Because I think for a lot of people who might be watching, I didn't even know this existed.
Well, when I completed my orthopedic surgery training, this field was so new and advanced that the only way to get training in it was to go and train directly under the people who are the innovators and the experts in the field. I was fortunate enough to be awarded the first fellow of the International Society of Hip Arthroscopy, first fellowship, and I spent time at several locations around Europe, especially Switzerland, as well as here in the U.S., where I received training directly from the world experts in the field.
Wow. And now, does this apply then to shoulders as well? Do we see this kind of preservation surgery when it comes to shoulders? Because I know I've got a little issue. I know my husband went in and had surgery on his shoulder. So is this something that we might be able to see going to that area?
I think so. I'm a shoulder specialist as well. I was fortunate to have been chosen as one of only 4 orthopedic surgeons in the U.S. to travel around and learn the latest and newest techniques in shoulder and sports medicine surgery. I was a Arthroscopy Association of North America fellow, and I performed surgeries from shoulder scopes to shoulder replacement.
Wow, we're very fortunate to have you. We're glad that you fell in love with the city and that you and your wife decided to move here. How has the transition, though, been from going from military life, being in the Navy, now to being in private practice?
Well, I'll miss the Navy. I love the people I worked with and the patients I treated. I went to Afghanistan with the U.S. Marines as a part of 1st Med Battalion and provided combat trauma care to U.S. and NATO service members. You know, I'm grateful to have had the opportunity to serve. But here back in the U.S., I was glad to have provided specialty hip and shoulder surgery to folks in our region. That's U.S. service members and their families that wouldn't have had direct access to this kind of hip and shoulder care if I hadn't been there. I'm very proud of that. They traveled from all over the Southeast to see me, and that's something I'm proud of. I'll miss the Navy, but I think I can take what I learned from the Navy to provide excellent care to my patients at Jacksonville Orthopedic Institute.
Well, no doubt about that. Well, sir, thank you for your service, and thank you so
Thank
much
you
for
for having
joining
me.
us today.
Thank you.
And yes, we welcome you and your wife here to the Jacksonville area. Proud to have you.
Thank you.
All right, and we'd like to thank Jacksonville Orthopedic Institute for sponsoring this segment. For more information or to schedule an appointment, you can visit their website, joi.net, or you can call them 904-JOI-2000. All the information is there on your screen. You can ask for Dr. Freeman.